Welcome, ladies and gentlemen. We'd like to call to order the Rutherford County Benefits and Insurance Committee. And first on the agenda is the approval of the minutes of the last meeting. Do we have a motion on those minutes? Did we hear something from someone? Who was it?
Ms. Boney.
Ms. Boney. And a second, Mr. Sandvig. Anyone have any corrections or additions? Okay, all of you then in favor of that, please say aye. Aye. Any opposed? Thank you very much. Now, Mrs. Stinson, tell us about the financial condition of our insurance program.
Yes, sir. Beginning with Fund 264, we'll look at the month of May. Our per employee per member cost when looking at our self-funded claims experience ended the month at $698 compared to prior year of $792 for a year-to-date average of $857 compared to prior of $818. When we combine our on-site medical experience, our total per employee per month increases to $741 compared to prior year of $823 for a year-to-date of $893 with prior year-to-date average of $853. Our current, we are at 4.6% at our current demonstrated trend. Moving on to Fund 266. At the end of May, our year-to-date is $1,471,195 compared to a prior year of $732,110. Now, I will remind the committee that we've had one large claim within this fiscal year, which contributes to the significant increase for this year over last year.
So does that complete your report, Ms. Stinson?
Yes, sir, it does.
Does anyone have any questions regarding that? Okay, and a second from Ms. Ely. All in favor, please say aye. Aye. Thank you very much. Okay, Mr. Good, tell us about our workers' comp and OJI programs, please.
Good afternoon. In the month of May, we had a total of 16 injuries requiring medical attention. That brings the total for the year to date up to 88. And as you look there, you can see how that breakdown is as far as the categories for last month and for the year to date. The total injuries that are OSHA recordable is a total of 45. And of those 45, 31 of them had restricted days, 10 were lost claim days, and 4 were all others. On the next page, you can see how that breaks out as far as this year as compared to the 2 previous years. And basically, even though while there's peaks and valleys, we're still running pretty much even. In 2012, we had 85 at this time. In 2013, we had 73, and we have 88 this year. So we're running pretty much even keel with what we have been. The total dollars incurred for the last month was $18,070. And that broke down to 13 of the claims being with the Board of Education, and the dollars incurred there were $12,170. The County General had the other 3, and dollars incurred there were $5,900. And you'll notice that the County General had all 3 of those that were with the Sheriff's Department and the County General. As you look at the last page of your report, you'll notice that the total dollars incurred in 2012 at this time were $256,000. In 2013, $149,000, and this year to date is $135,000 or $135,000. And of course, I'd just like to remind you, most of those claims for last year have matured and are closed out. All of them for 2012 are closed out. The ones for this year are not quite closed out, so those dollars are still fluxing as they mature. That's all I have at this time. Any questions?
Anyone have any questions of Mr. Good?
Mr. Good, could you tell us how many workers' comp claims we still have open right now? Are we running around what number?
It does fluctuate a little bit because some of them get open and closed, but right now we are at 16 old workers' comp claims.
Okay, thank you very much. If there's no questions, that's, again, another good report. Okay, Ms. Kelly Perrian will tell us about our wellness condition.
Hi, how are you today? I'm going to talk about the wellness report for May. We had the mobile mammography unit from St. Thomas of Rutherford come. We had 30 people in attendance. That was 75% of the slots were filled. They came to Blackman and Stewart's Creek clinics. Lori Cook with MedPoint Clinic and I worked with the judicial building, the courts that participated in the Biggest Loser courts. They had a contest to raise money for United Way, so they took $10 for people that wanted to participate, and we went with them for 6 weeks each Friday to weigh them in and measure, do their measurements and give them tips, healthy recipes, and exercise advice. And we printed a quote from Alicia Jernigan down below. The court employees that participated in this program lost 53 pounds of their and 33% of their combined body weight. So we're really glad to be a part of that. In May, Lori had 24 wellness coaching appointments at MedPoint Clinic with 13 patients. For our upcoming activities, starting July 1st through August 31st, we are going to have a healthy recipe challenge, and we're going to set that up through the newsletter. Anybody that wants to participate in that that sends us a healthy recipe will receive a farmer's market token to the Rutherford County Farmer's Market, and if we collect enough recipes, then we will publish an employee cookbook. On July 1st, Zensi opens live through Cigna, where we take our online HRA. So if anybody wants to test that out, it will be available July 1st. The Live Services webinar is about anger and learning to keep your cool. It's on 7:15, 11, or 1 p.m. And you can also access any of those at your leisure if you can't attend the live version. The DI conference this summer is at Siegel High School, July 29th to 30th.
Questions, Mrs. Barnes?
Yes, that's correct. Sure. So Zensi is the platform for the health risk assessment, which will be the requirement to complete during the designated time frame this year. And it is that 9-minute HRA assessment that has to be done online or through a smartphone process. We will be going out to all the schools. Cigna will actually be going out to all the schools to do education with the staff on how to utilize the platform, as well as we will have meetings with the different county general offices as well. And then what our recommendation, even though the platform will actually go live, we plan to internally do some soft test on that, get some small groups so we can walk through it, learn from that experience. It is available, but we will have the formal push out as we meet with each of these groups prior to the designated time frame in which it has to be completed. And so that is what the Zensi platform is that she's referencing. And one thing that Ms. Perrin didn't talk about is we did have an opportunity last week, I believe it was, to go out to one of the new hire orientations at the Board of Education to educate about Smart Steps and the MedPoint Clinic's services that we offer through MedPoint. She had a great response based on the feedback that I received to that. So if there are departments that are going to have their staff together, a large portion of their staff together for any, time or given purpose or special meetings, whatever, we're more than welcome. We welcome the opportunity to go out there and do those type of educational pieces. It's just good one-on-one education for the employee about the different things that's available to them. So if anyone has anything like that, we'll be glad to come to that as well.
Other questions? And this doesn't apply to me, Ms. Kelly, but tell us about this DI conference. What is that really? How do we transform teachers there?
That actually is a conference that the teachers go to for in-service, and they have a break room or set up in the cafeteria where several vendors or booths come. So the SmartSteps and Cigna and MedPoint get together and set up an interactive booth. We take the DermaScan machine. We take some of our materials just to educate and promote the clinic, the Cigna programs that are available. And we generally touch about 350 to 400 teachers there. And we keep account by, we have this wellness wheel and play games and trade prizes for games. So if we take 100 pieces out there and they're gone at the end of the day, then we count that we've met with 100 people. So it's just an estimate count, but it's as close as we can get because it gets very busy in there.
Okay, very good. Thank you. If there are no other questions, then we will continue on this agenda, and we're going to have a report from the Senior Director of Site Operations, Ms. Asher-Brenner, to tell us about what we've been doing at our clinics, our Walgreen MedPoint clinics. All right, so you may proceed.
You guys have a handout on your desk that I provided, and this is a review of the first quarter of 2014. In looking at the first quarter, we had 4,264 encounters, which was a 27% increase over quarter one of 2013. Ancillary visits increased 187% in Q1 of 2013, and this is based on the ancillary visits with the biometric screens that were done at the first of the year, because we were still doing those through February. Our unique health center serviced 3,005 patients, and these are unique patients, not just unique health centers, but that is out of the 11,603 eligible members that were eligible in Q1 of 2014, and that yields a penetration rate of 25.9%. And when you're looking at unique patients, it means that they're only counted one time in that quarter. So if they are in January and then they come back in February and March, they're only counted once. Our top diagnoses were the medical screenings for the diabetes and the lipid disorders, which were the biometrics, and acute respiratory issues such as pharyngitis, upper respiratory infections. Those were the leading diagnoses. And our net savings for the first quarter was $299,396, which is a 19% increase over Q1 of 2013.
And Mrs. Asher-Brenner, tell us how you determined this savings number.
Well, turn to page 2.
I'm ahead of you. Okay.
If you will look at the bottom right-hand side, you will see that our total cost avoidance in Q1 of 2014 was $875,557. It's the bottom right. It's the little net savings calendar. And then our expenses, which are subtracted out of that, which is the cost of the salaries of the employees and the medications and things, were $576,161, which left us a net savings of the $299,396.
So your cost avoidance would be avoidance of a higher level of care, avoidance to an ER, unnecessary referrals, things of that nature. Is that correct?
Yes, and it's also looking at the services that we're providing, looking at the usual cost within the community. So continuing with page 2 with the metrics, you see that you have the graphics with the total encounters. It shows the penetration rate with total penetration rate as well as provider penetration rate. So we're looking at those uniquely seen by the physician. and then a listing of the top diagnosis on the bottom left side as compared to quarter 1 of 2014, quarter 1 of 2013, and quarter 4 of 2013. And again, remember we were doing the biometrics in the last quarter at the end of 2013 and the first part of 2014, so your preventative service fall within that line.
Before we move on, though, I want to back up to the cost avoidance because it is a key metrics here, and I don't want to skim over it. As Ms. Asherbrenner said, it also compares our cost had they gone and received similar care outside of our MedPoint clinics. So there is an analysis that's completed. I will provide her information on what is our average cost, as an example, at a primary care provider in the community based on Cigna's reporting. That calculation is then compared to what was our actual cost inside of our clinic. So you have the avoidance of getting into a different level of care inside of our clinics, and then this cost reduction by treating within our clinics versus outside of the clinics. So for one quarter, you're looking at cost avoidance of $875,000, and then when you back out our operating expenses, we're still netting that $299,000 savings that she has. So that's a significant number I don't want to quickly overlook.
So your next one is just patient testimonials. But before I start there, I wanted to bring to your attention that the National Diabetes Statistics Report for 2014 was released by the CDC on June the 10th of 2014 this year. It was a review of 2012. It showed the prevalence of diabetes had reached a total of 29.1 Americans, and out of that, 21.9 million Americans, 8.1 million did not know that they had diabetes. They were undiagnosed. When you're looking at this study also, it also stated that approximately 86 million Americans ages 20 and up had pre-diabetes, so they were at risk for being a diabetic. And out of those, 9 out of 10 did not realize that they were at a risk. So what does this mean to you? The cost of the diabetic care is about 2.3 times what the cost of a non-diabetic person's care would be. And in the absence of diabetes, then we need to be able to have a way to identify those that are at risk as well as provide care in a managed type condition. And this is where your testimonials come in. Because one patient was identified with an elevated blood glucose from a biometric screening. He was seen in the clinic. He was diagnosed with diabetes. He had an elevated A1C. Care and condition management was started, and 3 months later, the A1C was moving to a managed level along with his other risk factors. So we're able to identify that, put him on the path to health in the right way. The next one is that an example was the patient was seen in MedPoint Clinic, wasn't feeling good, was having multiple problems. Care was provided, and their response was they're 100% better, and their spouse likes them better too. And I'm going, oh my gosh. And that was a direct quote. Another example was the patient was seen in the MedPoint Clinic, referred to the emergency department, but when they returned back, they also presented with a diagnosis of diabetes. But they were unsure of the next steps. They were confused. They did not know what direction they needed to go. And then Dr. Dooley and the family nurse practitioners provided education and condition management, and the patient has now understanding is what is needed for them to move on to a healthier lifestyle, and they continue to be managed by the on-site staff. So if we can identify those that are at a risk for prediabetes or at a risk with diabetes and reduce that, then the cost in the long term for their health and for the cost of the county is greatly reduced. And so I'm pleased to say that we're able to help the county with that management.
Okay, does anyone have any more questions of Ms. Asherbrenner? Are you guys happy with us, Ms. Asherbrenner? You think our patients are complying and you're getting obviously more participation?
We are getting more participation. I'm having more positive comments And I think the overall response to the providers that we have has been extremely positive.
I know we had a meeting with Walgreens last week before, and one of the things, it was a difficult transition whenever the contract was awarded. There's a lot of instability with employees in terms of trying to reacquaint themselves with the new staff. And what we are now seeing, and I think that is some of the feedback that they are hearing internally at Walgreens, is that people have now settled in to the new model with the new staff. They're hearing repeated stories of employees are learning where their provider will be at which clinic on certain days, and that they are actually following those providers as they need to stay within the MedPoint clinics for that ongoing treatment. So that's important, not only the cost savings for us, but also from a continuum of care and client satisfaction. So I was glad to hear that feedback in our meeting the other day.
Also, if you remember, I reported out on our patient satisfaction survey last year, and our patient satisfaction results will be coming up shortly, and I will be bringing those back to you also. Those have been exceptionally good. They were very good the very first year, even more so the second year. So I anticipate that trend to follow.
All right, thank you very, very much. And anyone else have any other business they want to bring before this group today? Nothing else? I have a note here that to tell you that there will be no meeting in July, so continue to have a nice vacation and time off, and we'll look forward to seeing you in August. Thank you for your participation very much. We are adjourned.